Hi, everyone. I'm Elaine Quijano. It's good to be with you. Thanks for joining us. Another top aide to President Trump has tested positive for the coronavirus. Stephen Miller confirmed his diagnosis to CBS News on Tuesday. He's President Trump's senior advisor for policy and the White House director of speechwriting. Miller's wife, Katie, who serves as press secretary for Vice President Mike Pence, has tested negative. She was diagnosed with COVID-19 earlier this year. Miller is the latest Trump administration staffer infected by what appears to be an outbreak at the White House. Press Secretary Kayleigh McEnany and 3 additional press staffers all tested positive this week. We also learned Tuesday that nearly all of the nation's top military officers are in quarantine after possible exposure to the virus. These new cases within the White House's inner circle come as President Trump continues to receive treatment for his own coronavirus infection. The president has not been seen since returning to the White House Monday evening after a 3-day stay at Walter Reed Medical Center. In a pair of tweets Tuesday, President Trump said he is, quote, feeling great, and that he is looking forward to his upcoming debate with Joe Biden, scheduled for next Thursday. But Biden says if the president still has COVID, quote, we shouldn't have a debate. It will ultimately be the president's doctor who determines whether he is able to attend that debate. White House physician Sean Conley says the president's vital signs remain stable, and the president reports having no symptoms. President Trump is also halting talks for the next round of coronavirus relief. He ordered Treasury Secretary Steven Mnuchin and top Republican lawmakers to stop discussions with Democrats on a federal package until after the election. Ben Tracy is at the White House with the latest.
Tonight, President Trump is abruptly ending negotiations with Democrats over a new COVID stimulus bill, tweeting, I am rejecting their request, and immediately after I win, we will pass a major stimulus bill. His own Federal Reserve chairman warned of tragic fallout.
Too little support would lead to a weak recovery, creating unnecessary hardship for households and businesses.
As crews in hazmat suits disinfect parts of the White House, the coronavirus outbreak in the president's inner circle grows. The virus now infecting his top staffers, communications aides, and now reportedly one of his military aides.
I don't want to go backwards.
The president's doctors, who have not briefed reporters since the president left the hospital, sending out this 4-sentence update after meeting with him today, saying his vital signs are stable and that the president reported he has no symptoms.
And now I'm better, and maybe I'm immune. I don't know.
The president is acting as if he's fully recovered, wanting to return to the Oval Office and the campaign trail, even though he's still believed to be contagious and on powerful medications, including the steroid dexamethasone. Doctors say a patient's energy level can dramatically crash once treatment ends. President Trump's doctors have also not released the results of his chest x-rays, which would reveal if he has lung damage or pneumonia. In a highly choreographed made-for-TV spectacle, President Trump returned to the White House Monday. Despite still being infected, he removed his mask, stood on the White House balcony, and told Americans the virus is not that big of a deal. In a video he later tweeted out.
Don't let it dominate you. Don't be afraid of it. You're going to beat it.
That brought a sharp rebuke from some families who have lost loved ones. Amanda Klute's husband and Broadway star Nick Cordero died of COVID in July.
Let it dominate your life? No one's letting it. Nick didn't let it. It wasn't a choice. Have some empathy to the people who are suffering and grieving.
With more than 210,000 Americans killed by COVID-19, President Trump is again comparing it to the flu. Tweeting today, we have learned to live with it, just like we are learning to live with COVID. But in just 7 months, COVID-19 has killed more people in the U.S. than flu has in the past 5 years combined. Twitter flagged the president's tweet for misleading information. Facebook took it down.
And Ben Tracy joins me now from the White House. So, Ben, let's start with the president's decision to hold off on coronavirus relief negotiations until after the election. What's behind that move?
Well, this was pretty strange today. Very abrupt tweet from President Trump basically saying we're done negotiating over this COVID stimulus. And it was strange because those negotiations were still ongoing and they were making some progress. Now, they were still pretty far apart on their overall number. The Republicans had come up to about $1.6 trillion. The Democrats were at about $2.4 trillion. So they still had some distance to cover. And there was some thought that Senate Republicans would never go for this deal, even if it passed out of the House. So perhaps President Trump was just trying to get ahead of that and make it look like he's controlling this narrative. But it was surprising for a couple of things. One, a lot of people have thought that President Trump needs this stimulus bill going into a very tough campaign and election day where he is far behind Vice President Joe Biden. It's something that he could have told voters, look, I'm still helping you. I care about what's going on in the economy right now, a way to juice the economy right before Election Day. Nancy Pelosi came out today seemingly very surprised by this move and even said that the steroids the president's taking for his coronavirus treatment might have explained kind of his rash tweet today on this topic.
Interesting. All right. So while talks on COVID relief have ended for now, Republicans are pushing ahead with confirmation hearings for Supreme Court nominee Amy Coney Barrett. What are Republicans saying about that?
Well, nothing is going to derail this train for the Republicans. Mitch McConnell has basically said he doesn't care about the pandemic or some of these infections that are now happening on Capitol Hill, even within the Senate Judiciary Committee. He wants to get this vote done before Election Day. So the train is still moving down the tracks on that one. And that's important both to Senate Republicans and also to President Trump, who very much sees this as a selling point for his reelection. He knows that a lot of his legacy, whether it's a one-term president or a two-term president, is going to be his reshaping of the judiciary and these 3 Supreme Court picks that he has been able to make in a very short period of time. So we should expect, unless several members of the committee are physically unable to come vote, I think you should expect that to keep moving forward.
Well, you mentioned in your piece, Ben, that the president wants to return to the Oval Office and even the campaign trail. Are any steps being taken to allow him to do either of those things?
Well, I was told by a senior administration official here at the White House today that the president did want to go to the Oval Office today. And this is one day, less than one day after he got back from the hospital because he feels good. They had to kind of talk him out of it and say that, no, we haven't put precautions in place for, you to be walking through the West Wing and hanging out in the Oval Office. So what they're trying to do in the meantime is set up kind of a temporary space for him in the White House map room where he can work and also do any sort of television addresses if he wants to do that. He could also appear on perhaps some Fox News shows from that location as well. So that is underway at the White House here. But you can expect that if the president continues to feel well, that he's going to push pretty hard to get back to business as normal. He has tweeted out that he expects to be back on the campaign trail and also expects to debate Joe Biden in just a couple of days.
Well, Ben, the president's doctors did not brief reporters Tuesday. What are some of the biggest unanswered questions about his medical condition?
There's a lot of them. I mean, they put out an update today, and it was 4 sentences on a piece of paper that basically said the president's vital signs are good. They used the word stable. They said the president reports no symptoms, and he's doing extremely well. That's obviously not a great medical update for the country, and we weren't able to ask those doctors any questions. Some of the questions that they have not answered over the course of several days now is, what did the president's chest x-rays show? Because if there is damage to his lungs, which is often the case when you deal with somebody who has experienced coronavirus, that would be a significant finding. It would also let us know if the president has pneumonia. They also have not said when the president last tested negative for coronavirus, which would let people know when he actually became infected in the people that he may have been around while he was before he was symptomatic but still contagious. So there's a lot of questions out there that these doctors have not answered. They've kind of hid behind the idea that federal health privacy laws don't allow them to tell us these things, but they can tell us anything they want as long as President Trump says it's okay.
Well, in a video Monday, President Trump suggested he might even be immune. He also tweeted, quote, "Don't be afraid of COVID. Don't let it dominate your life." Help us understand here, Ben, what appears to be the strategy here on the part of the president. Even as he sends that message, it stands in sharp contrast to the fact that more than 200,000 people in the United States have died from the coronavirus.
If there is a strategy, it appears to be the president wanting to show that he's tough, that he has survived this, that this is not that big of a deal and people should not be afraid. that actually is pretty much in keeping with what the president has been saying for months now. What is interesting is just a couple of days ago in one of his video messages from the hospital, the president said, you know, I understand this now. I've learned a lot about the coronavirus, and I'm interested to share that with you. And I think a lot of people at the time thought perhaps he was going to have a change of heart on this, that perhaps what he learned is that this is a very serious thing, having gone through this health scare, and that he was going to take more serious measures, more serious approaches to warning the country about it. That doesn't seem to be the case. The president seems to be kind of doubling down on what he has said before. Today in a tweet, he was again comparing it to the flu. So it's a bit more of the same. There are some people on his campaign that were hoping that he could use this as a bit of a reset in terms of his messaging on the virus. So far, that doesn't appear to be what the president's doing.
And Ben, on a vaccine, so the FDA Tuesday released guidance on its emergency use authorization for COVID-19 vaccines. We know that President Trump has talked about having a vaccine, perhaps by Election Day. But what can you tell us about this process? What do these new guidelines mean for that promise of a vaccine by Election Day?
Yeah, well, this has been very confusing because there's been a lot of back and forth on this. So basically, this guidance that the FDA put out, this is guidance for the companies that are currently in manufacturing vaccines. So they're in trials right now for their various vaccines. So once they get a vaccine that they think works, that they think is safe and effective, they need to go to the FDA and apply for what's called an emergency use authorization. So once they do that, they have to follow these guidelines to tell them if they qualify to even make that request. So there's some timelines in terms of how long they have to monitor the patients that have been on their trial. The reason the president didn't like that when he first heard about it is because he read into that, oh man, this is going to delay a vaccine. I'm not going to get a vaccine by Election Day because there's some stipulations in there that you follow people for up to 2 months. So the president very directly said from the White House a couple of weeks ago, well, we have to sign off on these guidelines and we may not do that. And then there was some reporting in the last couple of days that the White House had actually put its foot down and said, no, we're not going to sign off on these. Weirdly, today, the guidelines come out, and they're pretty much the guidelines that the FDA planned to put out. So we're not quite sure what's happening behind the scenes on that one, but the guidelines are out there. And it does seem like, you know, all the experts, even Dr. Fauci, are saying that it's very likely that within the next month we will find a vaccine that a company thinks is safe and effective. The difference is, on that day when you find it, it doesn't mean that everyone gets it. It's going to take a while to manufacture all that vaccine and distribute it around the country, which will take several more months, which is why they keep saying the average person should plan on a vaccine sometime next year.
It's a really important point. All right, Ben Tracy for us. Ben, thank you.
Thank you.